Hi everyone, it's Dr. Glenn Davies here. Now, I just wanted to have a little talk about my vision for what the healthcare system could look like in the future. Now, I'm filming from the greenhouse, just give you a little look around. The greenhouse is basically resting, but got some pretty nice vegetable gardens going on back there. But let's have a talk about a vision for the future for healthcare. And I think the current healthcare system is not fit for purpose, particularly general practice. Currently, we don't have a health-orientated model. We have a sickness model. Health is connected so closely with the pharmaceutical industry, and that's not the way that it's always been. If you go back to 1907, Rockefeller back in 1907 commissioned the Flexner Report, and at that stage there were lots of different schools of medicine. There was osteopathy, chiropractic, naturopathic, homeopathy, as well as the allopathic medical schools. The Flexner Report recommended that all be rationalized, and following that, allopathic or pharmaceutical medicine is all that predominantly what there was. And I think we're seeing the impact of that at the moment. I see doctors having such a limited amount of time to see a client, 10 to 15 minutes. That's hardly long enough to get to know someone. And in that time, they have to take a full history, they have to do an examination, they have to make a diagnosis, and then they have to prescribe a treatment. And by the time you get to that stage, there's really only enough time for one option, which is to write a prescription. And health is so much more than writing prescriptions. It's so much more than medicines. I think we need to be talking about health span, not lifespan. So what do I mean by that? Health span is the amount of time that you are well and active for. And the problem at the moment is that a lot of people are spending the last 10 years of their life with chronic poor health. So their health span extends up to, say, 70, then that final 10 years they spend with poor health. So even though their lifespan is to 80, their health span is only to 70. And what I imagine myself on my neighbour's roof, helping my neighbour repair the roof. I'm 100 years old, I'm fit, I'm agile, I'm flexible, I go to bed that night and I die in my sleep. That would be ideal, wouldn't it? My health span and my lifespan are the same. And imagine being that active at age 100, having that sort of community and relationships. That's what I dream about. So I have a new vision for health in the future because I think the current model is broken. So in this new model, we'll focus on health span and not on lifespan. And this vision of health, it's holistic, it's not reductionist. So what do I mean by that? So at the moment, medicine reduces everything to an enzyme process. It reduces it to very, very small areas of interest. We have cardiology, we have neurology, we have endocrinology, and that is just not the way that bodies, humans, and society works. We are complex beings living in complex environments. We need to be holistic in the way that we think about health, and so many of the Maori models really encapsulate this. So Te Whare Tapa Whā, the Meihana model, Te Wheki, all of these are acknowledging that we are more than just physical beings, that we are spiritual beings, that we are emotional beings, that we are part of communities and part of environments, and that we have histories, we have whakapapa. This concept of reducing everything down to just an enzyme process that you can interfere with a medication. And of course there will be impacts of interfering with the medication. You block an enzyme, there are consequences of doing that. It's not surprising that medications have side effects. So a holistic model will encompass more than pharmaceutical medicine. It will encompass all of those aspects of health. So what do I picture? I picture, rather than just pharmaceuticals being prescribed, I picture lifestyle medicine interventions being prescribed. So it comes down predominantly to nutrition. I think nutrition is the predominant tool that doctors of the future should be using. And I've got a quote here from Thomas Edison. So he was the inventor of the light bulb, but he seemed to be a pretty clever philosopher as well. And he said, "The doctor of the future will give no medicines, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease." And that's really what I'm modeling my concept of health on. Rather than jumping to the prescription pad, let's start with diet. And healthy nutrition is really the key. And what do I mean by that? Whole food nutrition. Food that resembles what it looked like when it was growing in the garden, when it was flying in the air, when it was walking in the paddock or in the bush, or was swimming in the sea. That's what food looks like. Whole food doesn't come out of a packet. Generally whole food is cooked from scratch. You need an oven, unless you're making a salad, which is a great example. So that's what whole food is, and we can get more complex as we get into the details of that, whether we're talking about a ketogenic diet to reverse diabetes, whether we're talking about a low-carb, healthy fat diet. We may even be looking at a whole food plant-based diet. But all of these diets are based around whole food, and that is the key. Exercise and movement. It doesn't even have to be exercise. Movement. If you're sitting at a desk, get up every 15 minutes and move. Our bodies are designed to move, and we need to be doing the right sort of movement and exercise for our age and our health, but movement is essential. And then sleep. High quality sleep is so important for the immune system, for our well-being. Exercise is a really important mental health tool. And then relationships and community, that is just so important. So that's what lifestyle medicine is. That's what I see the doctor of the future doing. That's what we are all about at Reversal NZ. So, that's my vision of what the doctors and health professionals of the future will be doing. They will be prescribing dietary plans, movement plans, helping people with their sleep and their stress management. Now, there will, of course, be a place for pharmaceuticals. I just think it'll be a much smaller place than it currently is. Perhaps 10% of what we're currently seeing. So, there we are. My vision for healthcare in the future. I'll leave that with you to think about. Cheers.